बैरिस्टर असदुद्दीन ओवैसी MP व सदर कुल हिंद मजलिस इत्तेहाद मुस्लिमीन ने लोकसभा में बताया कि मुसलमान गुर्बत की वजह से सेहत की सहूलतों तक रसाई नहीं रखते। इसके बावजूद वो ख़ानदानी मनसूबाबंदी पर अमल कर रहे हैं। यही वजह है कि मुस्लिम नौमौलूद की शरह अमवात हिंदुओं के मुकाबले में कम है। कोविड के दौरान 40 लाख हिंदुस्तानियों की अमवात का अंदाज़ा लगाया गया है। ये मोदी हुकूमत की गलत पॉलिसियों की देन है। इसके बावजूद भी अब तक सेहत आमा की खिदमत को मौसर बनाने के लिए सरगर्म इक़दाम नदारद हैं। सदर मजलिस ने पार्लियामेंट में महकमा सेहत के मुतालबात ज़र पर तकरीर की। उन्होंने कहा कि भारत में सेहत के शुबे पर GDP का 1.7% खर्च किया जा रहा है, जबकि बजट में इसका तखमीना 2.1% रखा गया था, जो नेशनल हेल्थ पॉलिसी 2017 की जानिब से सिफारिश करदा 2.5% से कम है।
So the Indian health expenditure, which was about 1.6 GDP and was budgeted to be 2.1 of GDP in 2023, is lower than 2.5 recommended by the National Health Policy 2017. And the 15th Finance Commission, sir, recommended 2.5 GDP by 2025. However, even this recommendation is consistently lower than China 3% and other countries, so Korea 5%. So the PMA BHIM scheme saw 22% reduction in allocation compared to BE of 23-24. Only 47% of the funds allocated in 23-24 utilized as per the revised estimates. So the NHM budget has been declining when adjusted for inflation. This has resulted in a situation where most PHCs and CHEs do not have adequate infrastructure or do not have basic human resources like doctors and nurses. For example, sir, in Simanchal, 4 districts have a population of 1 crore. Katiyar has only 57 PHCs, Araria 39, Kishanganj 16, and Purnia 51. One PHC is supposed to serve 30,000 people in Simanchal. Third point, sir, majority of Indians are forced to go to private hospitals. The majority of healthcare expenses are out of pocket. And this is the main cause of poverty and debt, sir. Sir, in Ayushman Bharat, 30,170 hospitals have been empaneled, out of which 56% are public hospitals. Shouldn't these hospitals already provide free healthcare? Standing Committee on Health also observed the hospitals were sparsely distributed across the country. CAG 2023 noted deficiency in quality of infrastructure at several empaneled healthcare providers. Sir, CAG also reported multiple cases of fraud where dead people were given treatment under Ayushman Bharat, sir. Sir, as of August 23, 39% teaching, 49% non-teaching positions across AIMs are vacant. Teaching vacancies are higher in campuses such as Madurai 77%, Jammu 61%, Rajkot 61%, and AIMs and Bibinagar in Hyderabad has 45% staff, sir, vacancies, sir. Sir, the Prime Minister taunted Muslims and spread false news that we have more children. But this own ministry had said that the TFR for the country is falling and the TFR of Muslims has fallen the fastest. And may I quote and bring the notice of August House that the TFR rate of Muslims have fallen down from 4.41 to 2.36. The Muslim men use highest contraception than the Hindu people of 34.10%. Kashmir and Lakshadweep, some of the have the lowest fertility rate. Muslim women, this is, madam, you are the minister, you should know, National Family Health Survey 2019.
Owaisi sahab, you are very senior.
अब उन्हें पूछ रहे हैं तो मैं क्या करूं, sir?
Only you address to the chair.
Thank you, sir. Madam को नहीं मालूम, minister है. Muslim women are now using contraception nearly as much as Hindu women, that is 60.2%. The truth, sir, is NFHS data says that Muslims lose access to healthcare facilities due to poverty. Despite this, Muslims have better sanitation, they practice family planning, and because of this, Muslim children have lower infant mortality rates than Hindus. Unfortunately, NFHS data shows that neither in life nor in death discrimination stops. If a forward caste non-Muslim is up to 50 and OBC Muslim only live till 43, Adivasis die 4 years sooner than the upper caste. Lastly, sir, I would request the Honorable Prime Minister to inculcate a scientific temperament as the Constitution Article 51 said. Let me remind this August South that Priyam once said that surgery is carried out on a human body when it is healthy. He had once said that plastic surgery and in vitro fertilization existed in the past. This is reflected today in the fact that 40 lakh Indians are estimated to have died during COVID thanks to this Modi's rule. It is reflected in the fact that the government has still not taken any active steps to improve healthcare delivery in India, sir. This is what I have to say. Thank you.
Thank you.
जश्न आज़ादी हिंद के ज़िमन में मीना हॉस्पिटल की खुसूसी पेशकश। आइए अमराज से आज़ादी व छुटकारा पाएं। 15 जुलाई ta 15 अगस्त मुफ्त हेल्थ कैंप। गरीब व जरूरतमंद मरीजों के लिए खुशखबरी। तमाम अकसाम के मुआयनाजात पर 20% डिस्काउंट। रजिस्ट्रेशन जारी है। माहिरीन तिब व सेहत से मुफ्त मुशावरत। सेहतमंद मुआशरे की तश्कील का जामिन। आलमी शोहरत याफ्ता डॉक्टर्स की खिदमत। बेहतरीन इलाज व मुआलजे की सहूलतें। असरी तकाज़ों और मिशनरी से लेस शानदार दवाखाना। अवाम की खिदमत थी मीना हॉस्पिटल का नस्बुल ऐन। मीना सुपर स्पेशलिटी हॉस्पिटल, शिवरामपल्ली, राजेंद्र नगर, पिलर नंबर 254, हैदराबाद।